Director General Dr. Tedros Ghebreyesus has emphasized the importance of ensuring societies across Africa be provided with coronavirus vaccines in efforts to slow the spread of COVID-19. Ghebreyesus was speaking during a virtual joint meeting of AU Ministers of Health on COVID-19 in Africa.
We have seen an encouraging decline in cases and deaths since the peak in mid-January. However, several countries in the continent continue to report sustained transmission and increase in some areas. It's critical that none of us are complacent. What's happening now in many other parts of the world can happen in our Africa if we let down our guard. In many countries, the emergence of rapidly spreading variants combined with premature easing of public health and social measures and the inequitable distribution of vaccines is having tragic consequences, as we all know. But we know what works. There are many countries that have shown that with a consistent and tailored use of proven public health measures, this virus can be controlled, even without vaccines. Although our continent has seen fewer cases and deaths than other regions, Africa has suffered from major disruptions to health systems and health services. New WHO data show that as a result of COVID-19, 60 immunization campaigns are currently suspended in 50 countries globally, including many in Africa. Measles campaigns have now been delayed for more than a year, and serious outbreaks have erupted. WHO and our partners are working with countries to restore immunization services.
Speaking at the same meeting, the Director of African Centers for Disease Control and Prevention, Dr. Ngenzazong, says the continent's war against the pandemic has been effective, but notably the second wave has been fatal all over the continent. He added that the third wave is already causing havoc in some countries.
As a continent, we have fought a very strong battle, and the numbers have come down after the second peak nicely. However, what you see at the very tail end of that shows a trend that is undefined. It clearly shows that some countries continue to see an increase in number of new cases, whereas some countries are witnessing a decline in number of cases. Let us now look at the different regions. In Southern Africa, for example, over the last few weeks, we have observed a slight increase of over 4%. And this is in a region where they have bent their curve from the second wave very, very nicely. Then we look at West Africa, a very similar trend, but again, which shows that the second wave was higher than the first wave, but they continue to decrease their numbers over the last 4 weeks or so nicely, with about 10%. Then we look at Central Africa. Again, the second wave seems more aggressive than the first wave, and over the last couple of weeks, we have recorded about a 64% increase in the cases, daily cases. North Africa, we see that after bending their curve very nicely, they are now beginning to see a slight creeping up as a region of about 0.2%. And East Africa, interestingly, they have gone through their third wave, where not all countries, some of them, and I'll go into that subsequently, but it's a slight, nice decline slowly. So the continent, as I lived the regional trends, showed a very heterogeneous pattern across where we are with respect to the second and third wave. So this is a summary of what we have seen. as of the 3rd of May, 52 countries, or 95% of all member states, have experienced second wave, and 40% of that, or 77%, are more severe. 13 countries, or 24 countries, have experienced the third wave, and 10 of those numbers, that is 77%, seem very severe.